Ebbinghaus was a prospective study of cognition embedded within the larger cardiovascular outcomes trial known as the FOIA study. And FOIA compared evolocumab, a PCSK9 inhibitor, to placebo in patients with stable cardiovascular disease. That was a large trial, over 27,000. In Ebbinghaus, we studied a little under 2,000 patients and had them tested serially for various tests of cognition to see if there was any change in memory or other mental tasks during the period of the trial. The primary measurement criteria we used was something called CANTAB, which is out of actually Cambridge in the UK. And it's the standard tool in this field to assess cognition. It's been well validated. It's been used in many, many trials over 3 decades. And there are a series of tablet-based tests, computer screen, including things like, find where the hidden blue token is amongst these squares, and then once you find it, it gets hidden again. You've got to search again. And there's another game that's like the memory matching game that we played as kids, concentration. And then there's another task that basically is reaction time. Put your finger on this bar. Once you see the yellow circle light up, move your finger there as quickly as possible. That was the main tool we used, but we used 2 other techniques as well, measures of cognition. One was a patient survey at the end of the study, asking them 23 questions about memory and organization and things, other tasks, mental tasks like that. And the last thing is we also looked at adverse events during the trial reported by the investigators. The outcomes are easier to explain than these tests that we use. The outcomes were no difference between evolocumab and placebo in any of the CANTAB tests, in the cognition survey at the end of the trial, or in adverse event reporting. And a corollary to that is not only no difference between evolocumab and placebo, but we didn't see any signals for differences across the LDL cholesterol achieved. And we binned them in very, very low LDL, less than 25 milligrams per deciliter. So that's on the order of, 0.6 millimoles per liter or less, and then 25 to 40, and then above 40. And even in patients who got to very low LDL cholesterols, there was no impairment in their cognition by any of these measures. Well, I think, one of the limitations of this study is the FOIA trial went on for a little over 2 years. We had about an average of 20 months follow-up in Ebbinghaus, and we treat patients with high cholesterol for decades, if not lifelong. So what you really want to know is, what happens over the long term with memory and cognition. And in fact, the sponsors committed to do an open-label extension study where a subset of patients will have serial cognitive tests in an ongoing fashion. So I think that's probably the next direction. Well, it's not an uncommon thing that our patients say, geez, my memory's starting to fail, particularly our older patients, or I had an episode of confusion. And in the past, there was controversy over, is this related to their medications, particularly the cholesterol medications? Is it related to having a low LDL? And what we found in this study is the answer was no to both of those, not related to at least a PCSK9 inhibitor, and not related to the degree of LDL lowering. So I think it provides some reassurance to clinicians that they can prescribe these medications and not have to worry about declining cognition due to the drugs or due to a low LDL. And on the other hand, I think it's helpful because, if the patient says, I'm having trouble with my memory or I'm having these episodes of confusion, you can check that off your list and then say, okay, what else could it be? Is this a sign of, low blood flow to the brain because of some other reason, and proceed with the workup in that direction. Well, if I take a step back, I would say, first of all, that here's a third class of drugs, PCSK9 inhibitors, that not only lower cholesterol but improve cardiovascular outcomes. So we know statins do that. We learned recently that ezetimibe does that as well, and now PCSK9 inhibitors. Secondly, that we're talking about much lower LDLs than we were a decade ago or when I was in medical school. And they're safe to get to that low levels, and they don't affect cognition. the very low LDLs or use of this class of drugs, PCSK9 inhibitor. Well, we know about evolocumab for sure. I don't think that there's any reason to think a priori to be different for other drugs in this class.